Hello, you're tuning in to this presentation if you are a member of the Boilermakers National Health and Welfare Plan Canada and you are a person who is currently covered as an active member with coverage received through your dollar bank, and your benefits are going to terminate either at the end of April or the end of May 2020. This presentation is for you. Here's what we're going to cover. Again, who this summary is for, what the objectives are of the COVID-19 relief program designed by the Board of Trustees of the Boilermakers National Health and Welfare Plan Canada, who is eligible, a mapping of the current active member plan, and the 2-month extended benefit coverage under the COVID-19 relief program. What benefits are covered under the 2-month extended benefit plan, what rules there are, what are the next steps that you need to take, and some information about the plan's CV19 portal. So the objectives of the COVID-19 relief plan is really meant to address the current situation of unemployment amongst Boilermakers in Canada due to the COVID-19 pandemic. The impact of that is different in every province, but generally there is high unemployment and reduced work opportunity. The program is meant to be short-term in nature because no one knows what's going to happen next with the pandemic or in fact with employment opportunities. So this program, as currently provided, is meant to run for a 2-month period. You'll see that the benefit design in the COVID-19 relief program extended benefits that will apply to you reflect the healthcare services that are available in the market now. And of course, the Boilermakers National Health and Welfare Plan Canada was established in 1970. This is the first pandemic that it's had to manage through, but it has had other serious events take place, including high levels of unemployment. It's necessary when designing this program to make sure that the National Health and Welfare Plan is sustainable for the long term. So this shows you a summary of the ways coverage will be extended in the plan. There are 3 main categories. If you are falling out of coverage as an active member at the end of April or the end of May, you fit into the center category, but we'll talk about the other 2 just briefly. First of all, there is a pay-direct program being extended for those individuals who are running up against the plan's 12-month maximum pay-direct period. And then in the last box, there is a benefit credit system in place for members whose coverage does extend for them right now beyond the end of May of 2020. For you, though, because your coverage is going to run out at the end of April of 2020 or the end of May 2020, we need to address that concern that you would be having now. So this extended benefit plan applies to you. The plan will continue your coverage on an extended benefit plan for 2 months. We'll talk about the coverage in a few more minutes. The extended benefit coverage is meant for members who are in good standing of the International Brotherhood of Boilermakers, the IBB, and that is verified by the applicable business manager. The 2-month extended benefit plan benefits have a design that really extends critical coverage on a short-term emergency basis. Not all services are available now, as everyone knows. There is practically no dental service available in Canada at this time, no vision care, very little in the way of paramedical practitioners, and the extended benefit plan takes that into account. It's important to know that benefits that you've already received as an active member, where there are coverage limits applied, for example, anything to do with limits with respect to how paramedical services are delivered, annual or per visit maximums, those limits will also apply in the extended benefit plan. How do you see, in a simplified way, the extended benefit plan compared to the active member plan? So for you, this is a very simple transition. If you are covered by the plan using your dollar bank and your benefits terminate either at the end of April or at the end of May 2020, then you will automatically be enrolled in the COVID-19 extended benefit plan. There is nothing that you need to do other than be sure that you have maintained your membership in good standing with the IBB. Now we'll look at the benefits that are covered in the 2-month extended benefit plan. In the center, you will be familiar with the active member coverage that you already have. And to the far right-hand side, you will see how that coverage extends into the 2-month extended benefit plan. So life insurance continues, accidental death and dismemberment continues in the same amounts as active member coverage. Dental services are not included in the extended benefit plan except for dental emergencies. That makes sense because dental services are broadly not available in Canada now during the time of the COVID-19 pandemic. Vision care benefits for active members are also not included under the extended benefit plan except for emergencies. Again, vision care services are broadly not available in the COVID-19 pandemic environment. Disability benefits in the extended benefit plan look like this. The special disability benefit that applies to any member who wishes to retire on or after his or her age 55 as an early retiree is eligible to apply for the plan's special disability benefit. This benefit is meant to replace the lost pension income as a result of retiring early. As you know, this benefit extends up to age 65 and will replace that lost pension amount up to $1,000 per month. It's very important to remember that if you are applying for this benefit, you must learn in advance if you qualify, which means that you must provide medical evidence that demonstrates that you have a career-ending disability. And your special disability benefit and your pension must start at the same time. That means that those applications must be completely in sync and there are no late or retroactive applications allowed. Active members have short and long-term disability benefits in the plan. A little description of those is included here. The extended benefit plan does not include short or long-term disability benefits. As you know, under the federal relief program due to the COVID-19 pandemic, there are broad extensions for unemployment insurance, and members would be expected to enroll there. With respect to the plan's major medical and drug coverage, the active member benefits are shown in the center of this slide. You'd be familiar with those already. Those rules extend to the 2-month extended benefit plan. We'll cover more in a minute. The plan's very valuable prescription drug benefit continues into the 2-month extended benefit plan in the same way as you had coverage as an active member. The plan covers brand name drugs, generic drugs, biologic drugs, and biosimilar drugs on the same basis as you had in the active member program. The plan, just like for active members, does not cover over-the-counter drugs, vitamins, or minerals, and it doesn't cover medical cannabis. Paramedical coverage for practitioners is delivered differently under the extended benefit plan, but in fact, active members see this delivery difference now in the COVID-19 pandemic environment. So the active member coverage is shown in the center and the 2-month extended benefit plan in the far right-hand column. You will see that if the benefit service can be delivered virtually, pursuant to the rules of the practitioner's regulatory body, then it will be covered by the plan. So, for example, chiropractic, speech therapists, osteopaths, and naturopaths are able to deliver services virtually, at least some of them, under their regulatory body. They would be continued under the extended benefit plan. And here is an example of how limits that you may have already reached or started into as an active member. For example, the $300 annually per practitioner will carry forward into the extended benefit plan. Acupuncture and massage therapy is not included under the extended benefit plan. For physiotherapists and occupational therapists, if the benefit is provided virtually pursuant to the rules of the applicable college, then they will be allowed under the extended benefit plan. Certified athletic therapist services are not included under the 2-month extended benefit plan. The plan's mental health benefit is very important, and as we know, psychologists and social workers have been delivering services virtually since the beginning of March. If you receive a benefit that is provided virtually, allowed by the practitioner's regulatory body, then it will be covered under the extended benefit plan as well. Here again, you need to understand that the plan's limits, which are calendar limits or per hour limits, apply, and any services that you've received within the applicable time as an active member are taken into consideration in your coverage under the extended benefit plan. So quite simply, you don't start over with a new limit. To continue on, the extended benefit plan again takes into account what is available in the current healthcare environment. So the extended benefit plan will include ambulance services, it will include accidental dental, the annual medical exam, audiometric testing. It doesn't include semi-private hospital coverage that is included under the active member plan. And you may know that if your admitting physician to a hospital requires that you receive semi-private or private coverage, that is the responsibility of your provincial Medicare program, not the plan. Medical services and supplies, with the exception of oxygen and oxygen supplies, are not covered under the extended benefit plan. Again, to be reflective of what is available in the COVID-19 environment, hearing aids, private duty nursing, mobility assistance equipment, and the age 65 provincial plan benefit are not included in the extended benefit plan. However, an individual who incurs travel costs related to medical treatment where they need to travel at least 100 kilometers to receive the medically necessary treatment will be included in the 2-month extended benefit plan. Again, any part of that limit that has already been reached as an active member is taken into consideration in the 2-month extended benefit plan. Finally, then, the plan's employee assistance program supported by FSEAP and the plan psychology benefit are included in the extended benefit plan. Members that are familiar with FSEAP know that the Boilermakers have their own toll-free telephone line and that members can receive services virtually within a very short period of time. Here's just a quick summary of benefits then, comparing active member benefits and the 2-month extended benefit plan. Life insurance and accidental death and dismemberment are the same. Special disability benefits are the same. Vision care benefits are not included in the extended benefit plan except for emergency exam services. Dental services that are included in the active member benefits are not included in the 2-month extended benefit plan except for emergencies. Drug coverage is the same for active members and in the 2-month extended benefit plan. Paramedical services, as we covered a few minutes ago, are provided if the service is provided virtually pursuant to the applicable regulatory body. FSEAP services are also included for everyone, as are audiometric testing benefits. One thing you'll notice is emergency travel assistance benefits are not included in the extended benefit plan. We all know no one's going anywhere now with all the broad limitations on travel, so active member benefits still have that service included, but there is really no access, and they are not included in the 2-month extended benefit plan. Let's look at the rules that apply to the 2-month extended benefit plan. First of all, as a person who is currently an active member but running out of dollar bank coverage, you will be informed by the plan of your coverage and the rules. You don't need to worry about contacting the plan. The plan will know exactly who you are and how to contact you. You will be given 2 months of extended benefits if you run out of active member coverage either April 30th or May 31st, 2020. You don't require any payment to be made to the plan. This coverage is being extended to you with no cost to you by the assets of the Boilermakers National Health and Welfare Plan Canada. In order to receive the extended benefit plan, you must be and remain a member in good standing of the IBB. Your business manager will confirm that for the plan. Any claim that you incur under the extended benefit plan must be filed electronically by your provider. The plan is not receiving paper claims. Your providers know how to sign up for this service, and in fact, it's in your best interest to have your providers file claims electronically for you. Any payments made under the plan for claim services received must be made to a Canadian financial institution. The plan will not issue paper checks. And as you know now, the plan has a broad appeal process for members who disagree with the decision that's made by the plan or want to comment on its coverage. If you are having any concern whatsoever, please use the plan's appeal process, which is described on the plan website at boilermakersbenefits.ca. So what next steps do you need to take? First of all, watch for your plan communication. The plan will be sending a customized communication to you to describe the coverage that you will be eligible for under the extended benefit plan and when that coverage will take effect. Make sure you understand the new coverage. This presentation went over the differences between the active member and extended benefit plan. Make sure you understand that before you incur a claim that may not be covered by the plan. While you're waiting for your communication, sign up now using the plan's access for direct payments to your bank account. You can access that facility under the plan by going to the plan website at boilermakersbenefits.ca. Sign up for direct deposit of payments by going to the health plan icon at the top of your screen and then going to the far right side under Submit Claims online. It only takes a few minutes, and once you've done it, you're set up. Finally, remember, any provider that you're using under the plan must submit claims online for you. Finally, you may have some questions about this presentation or a communication that you received from the plan about your coverage. The plan has set up a new email portal, COVID-19 at boilermakersbenefits.ca. You can send any question that you have through that portal. Please just let us know your question. Do not include any personal health or other information in your email. We don't need your social insurance number. We don't need any information about any medical condition or your date of birth. The plan will be able to identify you, and if not, the plan will reach back out to you and ask you the question. We know there will be lots of questions. The COVID-19 relief program, and in fact the COVID-19 pandemic, is affecting thousands of Boilermakers. Please be patient. Once we've received your email, it will be sent to the right person who can respond to you. We will have a high volume, but we will get back to you. Thank you so much for listening to the presentation. We hope it's been helpful.